As you probably are aware by now, the 77th World Health Assembly is continuing in Geneva, Switzerland. And in addition to the renewed push for them to find a way forward with the sovereignty threatening pandemic treaty that we're all tracking, there's also a lot of time being devoted to things like blaming Israel, promoting abortion, finding more ways to blame the world's problems on climate change, and all sorts of things that you kind of scratch your head wondering what does this have to do with world health. But anyways, there are some conservative member states that are pushing back, balking at the infringements on their cultural values. Well, joining me now once again from Geneva to discuss this is Washington Stand policy editor Travis Weber. By the way, he also is vice president for policy and government affairs at the Family Research Council. And I should let you know that in addition to joining us on Washington Watch Daily this week for updates, he's also providing regular blog style updates at the Washington Stand. So for reports and photos and other media that Travis will be providing this week, you can visit frcaction.org/who and get all that information, or you can simply text the word who to 67742. All right, Travis, good to see you again. Thanks for joining us.
Thank you, Jody. Good to be with you.
All right, some notable themes that have emerged so far. What are you seeing?
Yeah, so today at the World Health Assembly, a lot of the morning was taken up by what was known as the Committee A meeting. Committee A is one of the several committees that is meeting during the World Health Assembly this week, and they're reviewing proposals related to the program and agenda that the World Health Organization has in the coming years. And so one of those topics that was really discussed a lot today was universal health coverage. And this is something that the World Health Organization is really highlighting, really pushing. And you have an overwhelming majority of member states pledging to do what they can to achieve universal health coverage. Undoubtedly, many of these nations have especially some of the poor nations with ongoing health concerns have significant things they're trying to address. But it was really interesting to see how lockstep the nations are with this concept of universal health coverage. And frankly, I think it probably means different things to different people. A lot of the European nations were pledging their support towards sexual reproductive health, reproductive rights, even in the name of a global health security concept. That was Canada's delegate saying this is important to global health security, the same few lines linking that to reproductive health and the like. And so you saw a lot of push on that today. There were some things that were happening out of the public eye too. The drafting committee meeting to discuss a way ahead on the international health regulations and the pandemic accord. But those were several of the things, Jody, that were going on today.
I tremble to ask, who is going to pay for all this stuff? I would assume it would be shared among the member states, but I would also assume that at the end of the day, America will carry or be expected to carry a lot of the financial burden of this.
Yeah, the funding of this is one of the points of contention. There's a big push for funding. The World Health Organization itself is asking for $7 billion for its next 4 years of work. This is a big increase of funding. Today it was acknowledged in one of the meetings I was in at the end of the day that even funding the amendments to the international health regulations is going to be a sticking point in the next few days. And if that's a sticking point, then the pandemic agreement is which requires even more funding, it's more comprehensive, it's a sticking point there as well. So funding is a sticking point. And they ask nations to contribute voluntary contributions to the WHO, and there's private money coming in, but we really should look at the money as part of where the leverage is, how things are happening, and where it's going, and whether it's going to good use. I think that's a point that really needs to be addressed as we look at all this.
So as it goes forward, what do you see as being on the docket for the rest of the week?
Yeah, so international health regulations, the amendments to those are one item that's being discussed right now. We might get a report tomorrow morning from the drafting committee, which proposes some way ahead for those amendments this week, as well as the pandemic agreement. I think it's generally seen that the pandemic agreement is going to be kicked down the road months or several years. The question is what that will look like. The health regulations, some are saying they're optimistic about them being concluded this week. And we'll have to really watch it at what provisions are being proposed that would intersect with the pandemic agreement. But Jody, I think we can expect some proposals coming forth for how that might be addressed later this week. And we should look at where the sticking points still are. I mentioned funding, but there's also a sticking point about sharing of provisions between countries, and the term equity will be applied to this. But really, in this context, it's fairness and whether countries should have
about
to dole
15
out.
seconds.
And
Yeah, you finish your sentence. We're running out of time, Travis. But listen, I know we'll have you back on tomorrow. I want to thank you